peace. Love, 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 love. Peace, peace, peace. Unity, unity, unity. Peace, peace, peace. Love, love, love. Love, love, love. Peace, peace, peace. Peace, peace, peace. What's up, everyone? Thank you for subscribing. Thank you for tapping in with me. It is December 18th, 2024. It is 5:20 a.m. I'm going to do 2 readings today, inshallah, because something was just heavy on my mind, and these documents in my hand, I'm going to read those and let it flow from there. Children and mental health. Is this just a stage? From the National Institute of Mental Health. All children are sad, anxious, irritable, or aggressive at times, and may find it occasionally challenging to sit still, pay attention, or interact with others. In most cases, these are just typical developmental phases. However, such behaviors may also indicate a more serious problem in some children. What mental disorders can affect children? Many mental disorders can begin in childhood. Examples include anxiety disorder, attention deficit, hyperactivity disorder, ADHD, depression, and other mood disorders, eating disorders, and post-traumatic stress disorder, PTSD. Early treatment can help manage their symptoms and support their social and emotional well-being. Many adults reflect on how mental disorders affected their childhood and wish they had received help sooner. What are the signs of mental health conditions in children? Distinguishing between challenging behaviors and emotions that are a part of normal development and those that may be cause for concern can be hard. Consider and seek help if your child's behavior or emotion lasts for weeks or longer, cause distress for your child or your family, or interfere with your child's functioning at school, at home, or with friends. If your child's behavior is unsafe, or if your child's talk about wanting to hurt themselves or someone else, seek help immediately. Learn more about warning signs at www.nimh.nih.govern, .gov/children. When might children benefit from an evaluation? Younger children have frequent tantrums or are irritable much of the time, often seem fearful or worried, complain about frequent stomach aches or headaches with no known medical cause, are in a constant motion and cannot sit quietly, except when they are engaged in an activity they enjoy, such as watching videos or playing video games, sleep too much or too little, have frequent nightmares or seem sleepy during the day, are not interested in playing with other children or have difficulty making friends, struggle academically or have experienced a recent decline in grades, repeat actions or check things made time repeat actions or check things many times. For example, repeatedly checking to make sure a door is locked out of fear that something bad may happen. Older children have lost interest in things that they have used to enjoy, have low energy, sleep too much or too little, or seem sleepy throughout the day, have periods of highly evalu- highly evaluated energy and activity and require much less sleep than usual, spend more and more time alone and avoid social activities with friends or family, diet or exercise excessively or fear of gaining weight, engage in self-harm behaviors such as cutting or burn their skin, smoke, drink, or use drugs, engage in risky or destructive behavior alone or with friends, have thoughts of suicide, say they say that they think someone is trying to control their mind or that they hear things that other people cannot hear. Where should I start if I'm concerned about my child's mental health? Being proactive and aware of your child's mental health is an important first step. If you have concerns about your child's mental health, start by talking with others who frequently interact with your child. For example, ask their teacher about your child's behavior in school, at daycare, or on the playground. You can talk with your child's pediatrician or healthcare provider and describe your child's behavior and what you observe and learn from talking with others. You can also ask the healthcare provider for a referral to a mental health professional with experience and expertise in evaluating and treating children. How is children's mental health assessed? An evaluation by mental health professionals can help understand and clarify your child's emotional, behavior, and current situation. Based on this information, the mental health professional can decide if your child will benefit from an intervention and what intervention might work best. A comprehensive evaluation of child's mental health usually involves a parent interview to discuss the child's development history, temperament, relationship with friends and family, medical history, interests, abilities, and prior treatment. Information gathered from the child's schools, such as standardized test scores and reports on behavior, capabilities, and difficulties. If needed, an interview with the child for testing and behavior observation. Asking questions and providing information on your child health care provider could improve your child's care. Talking with a health care provider builds trust and leads to better results, quality, safety, and satisfaction with care. Here are some questions you can ask when meeting with prospective treatment providers. Do you use treatment approaches that are supported by research? Do you involve parents in the treatment? If so, how are parents involved? Will there be homework between sessions? How will progress be evaluated? How soon can we expect to see progress? How long should treatment last? Go ahead and make sure you drink your juice. Mm, mm, mm. This is beet juice, celery. Um, I probably should be put in this, but make sure y'all drink your juice, your teas, your waters. Stay healthy, y'all. If y'all just tapping in with me, I am reading Children and Mental Health. Okay. How is children mental health assessed? Evaluation. Oops, already read that. I'm sorry. How are children mental health disorders treated? I just dropped all that paper. That's okay. The mental health professional will review that evaluation results to help determine if a child emotions and behavior are related to changes or stresses at home or school, or if they may indicate a disorder for which they would recommend treatment. There are several treatment options that mental health professional may recommend. Psychotherapy, sometimes called talk therapy, which includes many different approaches such as structured psychotherapies directed at specific conditions. Parent involvement in the treatment, teaching the child skills to practice at home or school between sessions and homework assignments. Measures of progress, such as rating scales and improvements on homework assignments, that are tracked over time. Medications will depend on the diagnosis and may include antidepressants, stimulants, stabilizers, or other medications. Medications are often used in combination with psychotherapy. If multiple healthcare providers or specialists are involved, treatment information should be shared and coordinated between providers to achieve the best result. Family counseling, which includes family members to help them understand how child's challenges may affect relationships with parents and siblings. Support for parents, such as an individual or group sessions that include training and the opportunity to talk with other parents. Parental support can provide new strategies for helping a child manage difficult emotions and behavior in a positive way. That therapists can also coach parents on how to work with schools to receive classroom accommodations. How can the school support my child's mental health? Children who have behavioral or emotional challenges that interfere with success in school may benefit from plans or accommodation provided under laws that prevent discrimination against children with disabilities. Your child health care providers can help you communicate with the school. A first step may be asked the school whether accommodations such as individualized education program (IEPs) are appropriate for your child. Accommodation may include providing the child with a tape recorder for taking notes, allowing more time for tests, or adjusting seating in the classroom to reduce distraction. The U.S. Department of Education offers information and resources on what schools can and in some cases must provide for children who will benefit from accommodations and how parents can request evaluations and services for their child. The Individuals with Disabilities Education Act consolidates information about how states and public agencies provide early interventions, special education, and related services for infants, toddlers, children, and youth with disabilities. All right. That's that. And the other ones. All right. Next one is suicide thoughts. Everyone feels down at times. People can get overwhelmed by work or studies. They may have money worries. Relationships may end. A family or friend, a friend or family member may become ill or die. It's normal to have feelings. When difficult things happen, people may feel sad, anxious, angry, hopeless, or frustrated. After a few days or weeks, most people begin to have moments when they feel okay again. After a while, the times of feeling okay last longer than the times of feeling bad. Thoughts about suicide are not normal response to stress. Someone thinks about suicide a few times a week or almost every day. It's a sign of a serious health problem. Most people don't respond to stress or troubles in this way. Thoughts about suicide are important signals. You wouldn't ignore having a high fever or you wouldn't ignore having a high fever or severe stomach pain. People who have of suicide are getting important message. Thoughts of suicide are getting an important message. Their bodies and brains are telling them that someone needs to change. Something needs to change. What causes suicide thoughts? People may think about suicide because they are feeling great pain. They may have physical or mental health problems. They are having trouble finding solutions for their problems. They may feel they they don't deserve that time or effort it would to take to get help. They may not be able to turn to others for help. When these things all happen at once, it can cause a crisis. A person having suicidal thoughts may find it hard to believe things can change. This is the way this is why health professionals take suicidal thoughts seriously. When people who are thinking about suicide get treatment and are prevented from harming themselves, things can change. Suicidal feelings don't last forever. What can you do? If you have if you are having suicidal thoughts, take it serious. Take it seriously. Take it as you would severe physical symptoms. Don't try to go it. Don't try to go it alone. Go it alone. It can be hard to tell things, thoughts, and feelings to others and ask for help, but it's very important to do so. Talk to a professional who can help, a counselor, therapist, or campus counselor services, a doctor or other healthcare provider. Talk to others who can offer support, parents or other family members, friends, a teacher. Excuse me. Choose people you trust. You won't judge and you will urge you to get appropriate care. Talk to the clergy if you are religious or spiritual. Avoid alcohol or other drugs. They increase the risk you will harm yourself. This is from a lady named Stacy L. I felt hopeless and was thinking about suicide a lot. I also felt embarrassed, so I didn't want to talk about it. A friend took me to the counselor center. I learned some new ways to cope. I'm really glad I didn't hurt myself. If a friend talks about suicide, listen closely without judgment. Remain calm. Treat that talk seriously. Show by your tone and manner that you are concerned. Acknowledge the confusion and pain your friend feels. Encourage your friend to seek professional help. Offer to go along to a crisis center or counseling appointment. If the person is in danger, don't leave him or her alone. Remove weapons, especially guns or other means of self-harm. Call 911. Get someone else to help you. Tell a professional about that situation, even if it means breaking their confidence. Get support and take care of yourself. Talk to a counselor, your friends, your parents, and crisis line, or others you trust. When people who you are thinking about, when people who are thinking about suicide get treatment, things can change. Does treatment really help? Yes, treatment can. Protect the person from harm during the crisis. Provide support for strong emotions. Teach new ways to think so life events won't feel so overwhelming. Build skills for solving problems, resolving conflict, coping with stress, and connecting with others. Build confidence and self-esteem. When appropriate, medications can treat anxiety, depressions, panic attacks, bipolar disorder, or other conditions. This is from Derek D. I've always been moody, but things got worse when I started college. I started thinking about suicide. It scared me. I went to a health clinic and talked to the doctor. Now I'm seeing a counselor and taking antidepressants. I'm much calmer and can focus on my classes. It's definitely It's definitely better. I'm not thinking about suicide exactly. Some people think about harming themselves, but not seriously that they will die. They may wonder what would happen if they died. They might imagine killing themselves, even though they don't really like, really. I'm sorry, even though they don't really want to. These thoughts can keep coming back. They may pop up unwanted and be distressing. They can interfere with school, work, or relationships. These thoughts can also be treated. See a counselor. Have hope. People who have suicidal thoughts and got through the crisis give 3 reasons to be hopeful. Hopeful. It doesn't last forever. Treatment helps. Life can be better again. And this is the National Suicide Prevention Lifeline. It is 1-800-273-8255. 1-800-273-TALK. So that is 1-800-273-8255. If you are having suicidal thoughts. If y'all just tapping in with me, thank y'all for tapping in. Make sure y'all hit the heart button, the like button, the share button, because we want to get this video from 1 share to 10 shares, 10 shares to 100 shares, 100 shares. Hey, C Money. I'm good. 100 shares to 1,000 shares, 1,000 shares to 10,000 shares, 10,000 shares to 100,000 shares, 100,000 shares to, y'all know the rest, 1,000,000 shares. And it all starts with you. So the next read I'm going to read, oh yeah, go ahead and go to my wife YouTube page too, Dion's Life. That's Dion's Life, DIONNE''S Life. She's crushing it, y'all. Her numbers is way better than mine. So I'm catching up though. By the end of this year, inshallah, that I will be caught up to her. But again, it start with y'all. I know I support myself out of 100, so go ahead and share this video, y'all. YouTube, Tru Hicks on YouTube, Facebook, Joshua D. Hicks, So let's get to the next one. Social anxiety disorder, more than just shyness. Are you afraid of being judged by others? Are you self-conscious in everyday social situations? Do you avoid meeting new people due to fear or anxiety? If you have been feeling this way for at least 6 months, and these feelings make it hard for you to do everyday tasks, such as talking to people at work or school, you may have social anxiety disorder. Social anxiety disorder is an intense, persistent fear of being watched and judged by others. This fear can affect work, school, and other daily activities. It can even make it hard to make and keep friends. The good news is social anxiety disorder is treatable. Learn more about symptoms of social anxiety disorder and how to find help. I ain't gonna lie, that's so good. Ooh, man, excuse me. What is social anxiety disorder? Social anxiety disorder is a common type of anxiety disorder. A person with social anxiety disorder feels symptoms of anxiety or fear in situations where they may be scrutinized, evaluated, or judged by others, such as speaking in public, meeting new people, dating, being on a job interview, answering questions in class, or having to talk to a cashier in a store. Doing everyday things such as eating or drinking in front of others or using a public restroom also may cause anxiety or fear due to concerns about being humiliated, judged, or rejected. The fear that people with social anxiety disorder have in social situations is so intense that they feel it is beyond their control. For some people, this fear may get in the way of going to work, attending school, or doing everyday things. Other people may be able to accomplish these activities by experience a great deal of of fear or anxiety when they do. Okay. People with social anxiety may worry about engaging in social situations for weeks before they before they I'm sorry. People with social anxiety disorder may worry about engaging in social situations for weeks before they happen. Sometimes they end up avoiding places for events that cause distress or generate feelings of embarrassment. Medication. Hold up. Let me see. No, I don't think it'll go like that. Let me see. Oh yeah, no, I don't go like that. Yeah. Some people with this disorder do not have anxiety related to social interactions but have it during performance instead. They feel symptoms of anxiety in situations such as giving a speech, competing in sports games, or playing a musical instrument on a stage. Social anxiety disorder usually starts during late childhood and may resemble extreme shyness or avoidance of situations or social interactions. It occurs more frequently in females than males, and this gender difference is more pronounced in adolescents and young adults. Without treatment, social anxiety disorder can last for many years or even a lifetime. What are signs and symptoms of social anxiety disorder? When when having a when having to perform in front of or be around others, people with social anxiety disorder may blush, sweat, or tremble, have a rapid heart rate, feel their mind going blank, or feel sick to their stomach, having a rigid body posture, or speak with an overly soft voice, find it difficult to make eye contact, be around people they don't know, or talk to people in social situations, even when they want to, feel self consciousness or fear that people will judge them negatively, avoid places where there are other people. What causes social anxiety disorder? Risk for social dis- Risk for social anxiety disorder may run in families, but no one knows for sure why some family members have it while others don't. Researchers have found that several parts of the brain are involved in fear and anxiety, and that genetics influence how these areas function. But studying how the brain and body interact in the people with social anxiety disorder, researchers may be able to create more targeted treatments. Okay. Hey, baby. Um, Researchers may be able to create more targeted treatments. In addition, researchers are looking at ways stress and environmental factors play a role in this in factors play a role in the disorder. How is social anxiety disorder treated? If you are concerned you may have symptoms of social anxiety disorder, talk to your healthcare provider. After discussing your history, a healthcare provider may conduct a physical exam to ensure that An unrelated physical problem is causing your symptoms. A healthcare provider may refer you to a mental health professional, such as a psychiatrist, psychologist, psychiatrist, psychologist. I'm sorry. Or clinical social worker. The first step to effective treatment is to get diagnosed, usually from the mental health professionals. Social anxiety disorder is generally treated with psychotherapy, sometimes called talk therapy, medication, or both. Speak with a healthcare provider about the best treatment for you. Hmm. We talked about psychotherapy with children already. I'll just read that. Okay. Psychotherapy, cognitive behavior. Excuse me. Cognitive behavior therapy (CBT), a research-supportive type of psychotherapy, is commonly used to treat social anxiety disorder. CBT teaches you different ways of thinking, behaving, and reacting to situations to help you feel less anxious and fearful. CBT also can help you learn and practice social skills, which is very important of treating social anxiety disorder. CBT has been well studied and is the gold standard for psychotherapy. Exposure therapy is a CBT method that focuses on progressively confronting the fears underlying anxiety disorder to help you engage in activities you have been avoiding. Exposure therapy is sometimes used along with relaxation exercises. CBT delivered in a group therapy format also can offer unique benefits for social anxiety disorder. Another treatment option for social anxiety disorder is acceptance and a committing therapy (ACT). ACT acts ACT takes a different approach than CBT to negative thoughts and usage strategies such as mindfulness and goal setting to reduce your discomfort and anxiety. Compared to CBT, ACT is a newer form of psychotherapy treatment, so less data are available on its effectiveness. However, different therapies work for different types of people, so it can help to discuss what form of therapy might be right for you with a mental health professional. Okay. All right. Thank y'all for tapping in. Make sure y'all drink y'all juice today. That's some beets right there. Got me some good old tea. Shout out to my school for sending me this mug. So thank y'all for sending that to me. It says, this might be embalming fluid. Pittsburgh Institute of Mortuary Science. Ooh. Nah, it's tea. And it says, may this day be the day to lead us to peace, to happiness, and to joy. Look at that. In all things nature, there is something of the marvelous. Mm. All praises to Allah. What a beautiful day. Next, I'll be reading. Mm. Oh, got a new book. Got a new book. If it's over here, I'm gonna read that. Yep. There you go. Again, shout out to PIMS, Mortuary School, for giving me that cup. Really, it's Dr. Joe, so Thank you, Dr. Joe. The new book. Where's the new book? Right here. I was yesterday. Where did I get this? So yesterday, one of my colleagues asked me to come to his Sunday practice, so check him out. So I checked him out, and as I was leaving, you know, someone handed this to me. So again, you know, I've been getting blessed with the books. You know, I appreciate y'all for blessing me with that books. You know, blessing me with that wisdom, that knowledge, that information. So this book is Your Secret Source of Power: Unseen Dynamics for Expansion and Increase by Andre Gorham. Let me see if this is on Amazon or anywhere. Let me see. Give me 1 second, y'all. It says Your Secret Source of Power by Andre Gorham. Nope, I don't see him on the internet. I don't know. Maybe I just been blessed just to read it. It says Andre Gorham is a founder and senior pastor In addition, he conducts frequent crusades in the Philippines and other nations of the world, and he has a global ministry. He and his wife Cynthia are the parents of 3 sons. Okay. Random page, random chapter. So, random page is 88. Random chapter is 4. So I'll start here. It says, the power of belief. I'm excited to introduce you to the one factor that must be present in your life. You are to enjoy the promises of God. I don't mind telling you that when the truth burst into my being, it was my revelation straight from heaven itself. The best way I could share this with you is to open this pages of the book of Luke to the story of the birth of Christ. In the Galilee village of Nazareth, God sent the angel Gabriel to visit a virgin who was engaged to be married to a man who was descendant of King David. His name was Joseph, and the virgin name was Mary. Gabriel greeted Mary with the words, "Hail, thou art highly favored. The Lord is with thee. Blessed art thou among women." Luke 1:28. Of course, Mary was bewildered and hardly knew how to digest what she just heard. But the angel assured her there was nothing to fear, even though God has a big surprise in store. Here was the message. Behold, thou shalt conceive in thy womb, and bring forth a son, and shalt call his name Jesus. He shall be great, and shall be called the Son of the Highest. And the Lord shall give him unto the throne of the father David, and he shall reign over the house of Jacob forever, and of this kingdom shall be no end. Many were stunned and thought, how could that be possible? I never slept with a man, a promised son. Please allow me to pause for a moment and take you back to the time of Abraham, the prophet of old. He too had many questions, especially regarding what Almighty God told him concerning the future. I will make thee exceeding fruitful, and I will make nations of thee, and kings shall come out of thee. Genesis 17:6. And again and again, God reminded Abraham of this covenant, that of all future generations. But Sarah, his wife, was barren. Now in his old age, the Lord told him once that he would father a son with her. How did Abraham respond? Scripture records that he fell upon his face and laughed and said in his heart, shall a child be born unto him that is 100 years old, and shall Sarah that is 90 years old bear? There came to a voice from heaven saying, is anything too hard for the Lord? At the time appointed I will return unto thee, according to the time of life, and Sarah shall have a son. God told Abraham that his seed would be limitless like the stars in the sand, and the prophecy was fulfilled when he and Sarah welcomed a son, Isaac, a child of the covenant. Oops. All right. The power of the highest. Okay, stop right there. Well, thank y'all for tapping in with me. Um, my team just let me know that I gotta wrap this up. So again, thank y'all for tapping in with me this morning. Please share this video. Please heart it up, like it, do whatever you want to do. We promote peace, love, unity, community, family. And I just ask that you go over to YouTube and and go out and support my wife, Dion's Life. That is Dion's Life, DIONNE' Life. She's doing wonderful things. You know, she's crushing the game. So I just ask that you share this video. You know, we're going from 1 share to 10 shares, 10 shares to 100 shares, 100 shares to 1,000 shares, 1,000 shares to 10,000 shares, 10,000 shares to 100,000 shares, 100,000 shares. You know the rest. 1,000,000 shares. But it all starts with you. So go ahead and subscribe to the channel, Tru Hicks, YouTube, um, Joshua Hicks on Facebook. Same person, same mindset, same energy. Mama gave me the name of Joshua Daniel, and all praises to Allah gave me the name of Tru. You know, represent truth and righteousness. We about to sign out here, and until the next time, y'all. Peace. Peace. Oh yeah, this was the book right here too. All right, y'all. Catch y'all next time. Peace, 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 peace.